a couple of words maybe first on Canada's approach and why this kind of work really resonates for us. And I think the starting point for that is the global commitment to the Sustainable Development Goals that were agreed in 2015. Those are a huge opportunity, and I think we're only beginning to collectively understand and take advantage of that opportunity. And they have the potential to move the world past large-scale poverty and inequality to a large extent by 2030. For Canada, the only way to achieve the ambition of the Sustainable Development Goals is if women and girls are at the center of our efforts. Our feminist international assistance policy is really a comprehensive approach to the empowerment of women and girls as a means to significantly reduce poverty and inequality globally. And nutrition is a critical part of that vision for Canada. Digging into that a little bit more, I want to emphasize the link between gender equality and nutrition and food security outcomes, which is borne out by the evidence. And we know that women are the primary caregivers and main producers of food, but often have little power in household decision making. And we know that when they are empowered, they invest in the health and well-being of their children and their families and their communities. And these are fairly obvious gender impacts. They're still important issues that we're grappling with. But the SDGs offer us an opportunity to think about the less obvious ones as well. For example, child and early forced marriage. 16 million children a year are born to adolescent girls, and more than 1 in 3 girls in many developing countries are anemic. Anemia in pregnancy has a lifelong impact for both the woman and her child. It leads to poor birth outcomes, decreased productivity, and decreased earning potential for both. And what Canada's Feminist International Assistance Policy does for us is it pushes us to think about these issues together in a connected way, focused on the rights of those we are working to support. So like Deanna said, we need multisectoral approaches. For adolescent girls, for example, we can't just deal with anemia or just deal with family planning or just provide comprehensive sexuality education. We need to find ways to offer these services together, to keep girls in schools, to change social norms, to empower adolescent girls to navigate their environment and therefore break that intergenerational cycle of poverty and inequality. In the context of our Feminist International Assistance Policy, FIAP just doesn't sound good, and as someone from an organization named GAC, I'm trying to say the things that we see nutrition and agriculture as effective platforms to transform unequal power relations, to challenge social norms, and to eliminate gender stereotypes in order to reduce poverty and global inequality. And the Change Project, as we've seen, is an excellent example of how this can work in practice. In terms of lessons learned that will influence us going forward from this kind of thing, I think there's 2 main things I'd mention. The first is voice and participation. We need to engage with the marginalized people or the vulnerable people that we're trying to support and help and assist, and that's most often or very often women and girls. And we need to engage with them throughout, so from the design stage, through implementation, through evaluation of projects, and then the communication of that information afterwards. And we need evidence and sex and age disaggregated data so that we can achieve the greatest impact and scale up. Work like that was just presented here today is extremely helpful in scale up of effective interventions going forward. I think the question that Stella raised around behavioral change saturation points and when do we start to get diminishing returns by pushing too much, that's really important, and that's the kind of thing that can help us in many different sectors, and it's something that nutrition interventions like this can provide. Finally, the last aspect I was asked to think about, that clock is really intimidating over there, is it's just huge, is what the gaps are, or what are the things that we need to learn more about going forward. And I mean, the first one for me is adolescence. In Canada, we would use the expression the canary in the coal mine, and I think we've ignored adolescents collectively a little bit to our peril overall. Going back to my earlier example of child and early forced marriage, that cycle of intergenerational poverty and inequality will only be broken if we empower adolescent girls to be agents of change in their lives and their communities going forward. adolescent nutrition specifically has primarily been viewed in the context of adolescent girls as mothers, which is interesting and it's instrumental and it's helpful, but we need to look beyond that at an adolescent girl as an actor in her society. It might be partly because we don't have the evidence we need on their needs and how to best reach them. We don't have ways of enabling their voices. And I use the plural intentionally here because it's not one voice. Adolescents are not all the same either. And we need to disaggregate our approach, whether we're thinking about younger versus older adolescents or adolescents in humanitarian contexts versus what we think of as traditional development contexts. The last element that I'll mention is, it brings me back to my first comment about the opportunity of the Sustainable Development Goals, which really do require new ways of thinking, new ways of working across sectors, and ways of integrating new partners. We need to figure out how to operate in ways that bridge silos, and I think the work that was presented here today is a helpful example in how to start to do that. And there's kind of two issues in there that I would see. The first one is the transition from the Millennium Development Goal way of thinking, dealing with and responding to specific issues, to the Sustainable Development Goal way of thinking, which is really about the intersection of those issues. And the second is not just thinking about malnutrition or thinking about obesity and overweight or thinking about stunting, but actually thinking about all of those issues in an integrated way as well. We really have an opportunity now in this agreed context of the SDGs to focus on those we are trying to help, to put them at the center of our efforts, to listen to them, and using the evidence of what works to build interventions around them. And that is what Canada hopes to achieve with our Feminist International Assistance Policy and why we support projects like the one presented today. If I wouldn't have mentioned the snow, I would have made it on time. Thank you.